Regional Drug and Therapeutics Center, which is next to the medical school. I don't know if any of you have been through there. We are in a small building which is near Farmington Place, and we host the Yellow Card Center for Northeastern Cumbria. So today I'm here to talk to you about the adverse drug reaction scheme. So the objectives for the session is to define what an adverse drug reaction is and why are they important, and how can we spot them, what the yellow card scheme is, and how to report an ADI using the yellow card scheme. And I will also give you an overview of what the center does as a whole. So the MHRA, which is the Medicines and Healthcare Product Regulatory Agency, is the government agency that is responsible for ensuring the safety and efficacy of medicines and medical devices within the UK, and they monitor a scheme called the yellow card scheme. How they define an adverse drug reaction is it's an unwanted or a harmful reaction experienced upon administration of drug under normal conditions and which is suspected to be related to the drug. Now, a side effect can be classed as a type of an adverse drug reaction. So anybody who takes a medicine is susceptible to having an adverse drug reaction. There are different kinds of reaction. One of the major ones is a serious reaction. So a serious reaction is the one that is fatal or life-threatening. It can also be disabling or incapacitating. It can lead to hospitalization or prolonged hospitalization. Then it is classed as a serious adverse drug reaction. So why are ADIs important? ADIs are important because they lead to hospital admissions. They can also lead to death in certain cases, and patients in the community are mainly susceptible to majority of the adverse drug reaction that are seen in practice. Some of the hospital patients also suffer serious ADI reactions, so we need to be aware about those. And as patients, you can contribute more than us healthcare professionals because you are taking those medicines, so you are more involved in informing us about how you experience those and how you sort of portray them. So when we look at ADIs in general, they're important because if a patient experiences an ADI, they are less likely to stop taking a drug, and it can reduce the choices of available treatment. It can also reduce the potential effectiveness of the drug and reduce the quality of life for the patient involved. So if you look at it in a general point of view, if you suffer a side effect of any given drug, how likely are you to continue taking that drug if that is interfering with your daily activities of daily living, for example? You would want to discuss alternatives with the GP or specialist doctor to decide as to whether there is an alternative treatment available and whether this adverse effect or side effect can be eliminated altogether. So there are certain patient groups that are more likely to experience an adverse drug reaction. They include children, elderly patients, those taking biological medicines, so for example blood products and tissue antibodies and gene and tissue therapies, those taking herbal remedies. Now the problem with herbal remedies are they are not as stringently regulated as conventional medicines, so very little is known about their safety and efficacy. So they are more likely for any patient to be experiencing an adverse drug reaction when administered, which is why they are one of the core categories which in which we see adverse drug reactions normally. Also patients with multiple allergies. So in general terms, if a patient is allergic to multiple medicines, then that reduces the overall choice available for treating any given condition, and as a result you have to be very careful in selecting any individual agent for treatment of a given condition. Also patients taking multiple medicines, which most of the patients are these days. So because patients are living longer, they are having multiple illnesses as they live longer, and because of multiple illnesses they've got multiple medicines. Those medicines interact with each other, and that gives rise to a drug reaction as such. So how do we decide if an adverse reaction is related to a drug? The most critical thing is the timings. When did the reaction actually start? And has there been any changes or alteration within the dose that was given? So for example, whether it was a newly commenced drug or whether there was a dose alteration that led to the reaction. Are there any other possible causes that could be related to how the patient has experienced the reaction, and did the situation or the condition improve when the drug was stopped? If that was the case, it is highly likely that the potential effect seen is related to the drug. Is the reaction documented within the patient information leaflet? If it is, then it is a probable and a known side effect, so it is expected. However, if it is not, then it is possibly a drug reaction as well. Also, if when the drug was restarted, did the reaction recur? If that was the case, then again it is highly likely that the drug is a possible causative agent. So we move on to the yellow card scheme. The yellow card scheme is a spontaneous adverse drug reporting scheme. It is a voluntary scheme as such. It was started in 1964 and has been going since then. It is the world's first ADR reporting scheme. So what are the strengths of the yellow card scheme? It acts as an early warning sign for identification of adverse drug reaction with regards to unrecognized ones. So the key aim of drug companies to market the drug, they test the drug in select population groups who have a certain disease, but they don't test the long-term effectiveness of the drug, and if the drug is used in the long term, then there is highly likely potential that we would see more adverse effect than those already seen in the clinical trials, and that's what the yellow card acts as a warning system for. It also provides information about the risk factors that predispose the patients to certain drugs, so certain ADRs. So for example, patients who have diabetes are more susceptible to hepatic effects of methotrexate. Patients who are elderly, we advise against using coamoxiclav for longer duration and things like that. So all these effects have been picked up as through the ADRs, and that's why the restrictions have come into place. Also, when an ADR, the yellow card scheme shows that the product has a continuous safety monitoring throughout its period it stays on the market. So this is one of the key reasons that we continue monitoring the adverse effects related to any given drug for the duration it stays on the market, because although new products come all along, we should never forget the ones that we have been using, because that builds up our experience and makes us more confident in using them in certain patient groups. There are key weaknesses as well. One of the main ones is that reporting is voluntary, so not all the reactions are reported and reporting levels are still low, and which is why sessions like these help us raise awareness of the scheme so that more people become aware about it and report as they spot them. Also, it depends on the individual's understanding and the ability to spot them. Reporting for the newly marketed drugs, that is a key point. Reporting for newly marketed drugs remains high but falls off over time, which is what I was discussing earlier, that it acts as a continuous monitoring system, but reporting when a drug is newly launched, people are very much interested in it because you see that it's been tested in certain patient groups, so it will work in that group. But so there's a high level of interest and enthusiasm about it. But as soon as you become more confident and aware about using it, then reporting about that drug falls off, and that is one of the main weaknesses of the scheme. So what do you actually report on a yellow card scheme? You can report any problems or side effects related to medicines, medical devices, also defective medicines, counterfeit or fake medicines, and any reactions related to e-cigarettes and e-liquids. This is a new category that has been introduced due to ongoing use of the e-cigarettes and the vapors. So who can actually report on the yellow card scheme? All healthcare professionals are entitled to report on the yellow card scheme, and patients as well as parents and carers can also report on the yellow card scheme. So with regards to the patients themselves, they can report about the adverse reactions that they have suffered themselves or through their child or for somebody else they're responsible for, which could be their acting as somebody's legal guardian. Or they could also report about their partner or spouse or somebody else they are living with, if the person agrees to it. How do you actually report it? You can report it through various methods such as online. You can also get paper forms from pharmacies and GPs. There is also a telephone line you can report to, and for the technologically advanced ones, there is also an app these days which is available through Google Play and iStore. So when reporting an ADR, there are 5 key sections to complete. So the first one is the suspected side effect. So that is the effect that you have, that the person has experienced as a result of taking the drug. Now, with regards when submitting a yellow card, the key thing is to look at the suspected adverse effect. So you don't have to be certain that the adverse effect is related to any given drug. You just have to suspect it and able to report it. And the second section is the details of the person who has experienced the reaction. So that could be their full name, their date of birth, or just their initials as a minimum. This third one is the medicine or medicines that could be responsible for the adverse drug reaction. That could be just one single item or multiple drugs that could be the causative agent. The fourth section is optional, which is the GP or the hospital doctor details. Now, if you fill that in, the completed yellow card form will go to your GP or hospital doctor. So if you are planning to fill one, it would be a better idea to discuss it with your GP or any specialist doctor who has prescribed the medication in the first instance, just so that they're aware that you are filling it in. So, because what happens in majority of the cases is, if you fill it in, then they usually send you a request for additional information. So if your GP is aware, they can send that additional information to the agency if necessary. Also, the final section is details about the person reporting. So that could be about yourself, if you are reporting for yourself, or if you are reporting on behalf of somebody else, then you can put in your details as well. This is what the paper form looks like. I don't know if you can see it very clearly. So that is section 1, where you put in what the suspected side effect you had and how bad it is. So whether it's mild, bad enough, or cause death, or whether it's unpleasant, and how is the person feeling now. The second section goes on about the person who has experienced the suspected side effect. So it could be yourself. The new section that has been introduced is the pregnancy section. So now they're asking if it concerns a female, whether they are pregnant or not, because there are certain restrictions about using various drugs in pregnancy. So they want to focus on pregnant individuals for this period. So up to about 2021, they want to focus on adverse drug reaction related to pregnancy. So that is one of the new categories that has been introduced. The third one is the medicines that could have caused the side effects. So as you can see, the paper version only contains 2 medicines that you can list. If there are additional medicine, you'll need to fill in additional items. So if filling in online, you can just take and a new row comes along. But when filling in a paper one, you may have to fill additional ones just to complete the medicine section. The fourth one is the doctor details. So you would have to agree to your doctor getting a copy of the yellow card report. If you say no, then that won't be sent. The final one is the about you section. So that is the details of the person making submitting the report. And this is what the online version looks like. So based on what you're actually reporting, whether it could be side effects, whether it could be effects related to devices, defective medicines, fake medicines, or effects related to e-cigarettes, you can select the appropriate category, and you can also register on the site. This is optional. However, it allows you to come back to incomplete yellow card, because they ask so much information at the time. You may not have all of it in one go, and so it may not be necessary to complete it all at the same time. So making an account is probably advisable, although if you feel that you have all the necessary information, you can also finish it in one sitting. The final one is the yellow card app. So that is free to download. You can register and receive information about medicines of interest. You can also submit yellow card reports to that and see the progress on those, what's happened, and access medicines information about specific medicines of interest. Now, with regards to the centre as a whole, we are one of the 5 regional centres that cover England, Wales and Scotland, and the area we cover is the whole of North East England, Cumbria, Yorkshire and Humberside, and we are responsible for promoting the yellow card scheme. Traditionally, what used to happen was all the forms that you submitted used to come to us, and we used to compile the reports. Now they all go directly to the agency, and they send us quarterly data, and which is how we analyze trends, and then we target the individuals who have lower reporting to raise the awareness of the scheme. We are one of the centres that deals with this. The other centres are in Cardiff, Edinburgh, Birmingham and London, and they, as a whole, we coordinate the scheme throughout the UK. So that's all from me. Any questions?
Any questions? Are you getting many reports from patients and their families? Sorry, I missed the beginning and you might have already said that.
Well, patients and their families, they comprise about 25% of the overall report, so it is quite a high reporting, yeah, I would say, yeah. So healthcare professionals is about 75%, yeah.
You must excuse my ignorance on this. 1964, I've never even heard of the scheme before.
Well, one of our, well, because we have a contract with the agency, one of our aims is to promote it to the different charities. So we target about 5 charities a year. So our center director actually suggested to me to contact LIVErNORTH as an option, and then I got in touch with John, and that's how this all came about. So I'm surprised that nobody, because I'm new in the role and I've only been here for a year, and I'm surprised this hasn't been raised with you lot till date.
It was thalidomide. Thalidomide was how this came about, because the history of that was that it went through trials and the testing that normally happens. It was only after it was used in practice that people noticed the pattern. And sometimes you only find out things when lots of people use it. So this is as much as anything good can come from thalidomide, this is what it is. The difference is making this has been a doctor thing for a long time, and the difference is making it open to everybody. And it's all about patterns. So any one person with a reaction, you don't know whether, I mean, we spend our life looking at whether a drug in liver has caused a problem, and any one person it's difficult to say. But if 5 people have reported all of that, look at the plane crash with the Boeing 737-8, okay? One crash was a crash, 2 crashes that are identical, all of a sudden it's a totally different thing and all the planes are grounded. That's precisely what this is. And so the answer is, even if you think, don't assume that people know. So if you, and it's all about the timing, that's why extending it to patients is so important, because it's all about the timing. You know when you've taken a treatment whether it's come on from that. It's all about the timing. So even if you think, well, they must know about this, still report it. And one of the common ones, okay, is around, one of the things, an example of this is statins, okay, and muscle pain. Statins cause muscle pain, okay? But the experts will say statins don't cause muscle pain because people don't report muscle pain. But actually any doctor who prescribes statins knows that statins cause muscle pain. So even if you think people know it, fill the form in, it goes into the system, and it's for pattern recognition. Sorry.
That's fine. Absolutely fine.
But the thalidomide thing I was young enough to, old enough to kind of remember the fallout from all of that. But this is why, because the UK was hit with this, that's why the UK has this system.
Brilliant. Well, thank you very much. Now, there's an old tradition, which is that speakers get a pen and a supermarket token, but we need a photo of a handshake. Is that what you're coming to do? You're turning that off. Can someone take a photo? Actually, Alf, do you want to do the handshake?
I do.
Come on, you do the handshake. There you go.